Good morning. Today we'll be rationalizing your gastrointestinal exam for your module 1. Let's start. Number 1. The most common cause of peptic ulcer disease is which among the following? Stress, pancreatic cancer, NSAID, or infection? Answer. It's letter D. Why? Because the most common cause of peptic ulcer is your H. pylori. It's an infection of the stomach. It increases hydrochloric acid. Therefore, number 1, it's D. Next, patient with gastric ulcer will manifest the following except. So we're looking for something that is not related to gastric ulcer. And the answer is letter C because sleep disturbance is seen on duodenal ulcer. Duodenal ulcer. Duodenal ulcer is the type of ulcer na umaatake sa gabi. C is the answer. Next. Number 3, patient with history of peptic ulcer underwent surgery to prevent the development of complication. After a few months, patient returned to the clinic complaining of paresthesia. The nurse will show competency if she would do which of the following. So we're looking for the option that would indicate that the nurse know what she is doing. The nurse know what to anticipate considering the history of the patient about a history on surgery for the prevention of peptic ulcer. So the answer here is competency if she would letter ask for anemic complication because one of the surgery before for ulcer is gastrectomy. One surgery for ulcer is gastrectomy, and gastrectomy can lead to what you call your pernicious anemia. Sorry, pernicious anemia. And pernicious anemia, one of the manifestation of pernicious anemia is paresthesia. The answer here therefore is letter C. Next, number 4. Which food would you recommend for a patient who develops dumping syndrome? So we all know that the diet for dumping syndrome should be high protein, fat as tolerated, low carbohydrates. Okay, and patient needs to avoid simple sugar, salt, milk. Patient needs to avoid simple sugar, salt, milk. So let's eliminate yogurt. It contains milk and caramel sundae because these are ice cream. So B and D answer Dallas because roast beef has high in sodium, which is the salt. So the answer is Dallas tofu because usually tofu is steamed. Steamed. Okay, the answer is D. Next, number 5. In which of the following would the nurse position a patient during meal following gastric resection secondary to peptic ulcer disease? So we're talking about position of patient after meal. following gastric resection. So we all know that after gastric resection, there's a danger of dumping syndrome. And we all know that after meal, the patient should lie flat. Oh no, I'm sorry, this is during meal. I'm sorry, during meal. If the patient post gastrectomy has a chance of dumping syndrome during meal, patients should lie on low Fowler's position. After meal, this is different. After meal, the patient needs to lie or spine. But we're talking about during meal, habang kumakain. Boston is the answer. Next. Boston is the answer because this will prevent dumping syndrome. It will prevent dumping syndrome. Okay, next. Number 6. Which client behavior post after esophagoduodenostomy indicates that teaching us by the nurse has been effective? Answer. So when you say esophagoduodenostomy, the entire stomach was removed. Entire stomach is removed and the esophagus. So the doctor removed the entire stomach and the remaining esophagus is connected to the duodenum. So there's a chance that the patient may develop dumping syndrome. And we all know that dumping syndrome, milk is avoided, simple sugar is avoided, and do not drink plenty of fluids because this will further aggravate dumping syndrome. The answer is letter C. The patient may lie down immediately after meal because the pull of gravity will increase or will worsen the dumping syndrome. Okay, next. Number 7. Which of the following concerns would you address on a patient diagnosed with pernicious anemia? A. Driving hobby. B. Lack of iron stock at home. We all know that iron is not the problem in pernicious anemia. It's vitamin B12. Wound at his foot, probably. Or D. Occasional nausea and vomiting. The issue here is safety. One option concerns safety. The answer is letter A. Because we all know that anemia patient may become dizzy. And the patient keeps on driving, the patient is at risk for vehicular accident. Therefore, A is the answer. That's your concern. Next, number 8. Which of the following, if stated by the patient with vitamin B12 deficiency as a result of surgical management of peptic ulcer, indicates a need for further teaching? So remember, we're looking for a need for further teaching. Is it A? I'll ask for an assistance when unambulate. Eliminate A. Remember, looking for need for further teaching. Letter E is correct. You need to have an assistance because you have anemia. B. I need to stop from my gymnastic practice for the meantime. This is correct too. Because when you have anemia and you're a gymnast, you are prone to injury. C. I need to eat plenty of vitamin B12 rich food. This is the answer. Because the reason why there's an anemia because the stomach was removed, and therefore if your stomach was removed, you cannot absorb vitamin B12. So even if you eat a lot of vitamin B12, your problem is absorption. The problem here is malabsorption. So even if you eat plenty of B12, you cannot absorb it. Therefore, C is the need for further teaching. Next, patient with gastric ulcer is taking sucralfate for ulcer. This drug acts by doing which effect? A. Inhibit HCl secretion. B. Protect the stomach against NSAID. C. Increase blood flow to stomach. D. Promote gastric emptying. So first, let's try to eliminate options. Letter D refers to what you call your pyloroplasty. Pyloroplasty. Letter A is referring to H2 blocker. Letter C refers to your misoprostol. Therefore, the answer is Boston. This is sucralfate. B is the answer. Next, vagotomy was conducted in a patient with chronic peptic ulcer. This surgery is done to, so remember that the brain is the one that stimulates stomach to release HCl. And brain is connected to the stomach by your vagus nerve. So what do they do is they cut the vagus nerve so that the stomach is not stimulated to release HCl. So it helps when you have ulcer. That's vagotomy. Therefore, vagotomy is done to A. Decrease intestinal motility? No. Promote gastric emptying? No. Reduce gastric stimulation? Or lower down HCl secretion due to stress? So the answer here is letter C. That's the purpose of your vagotomy. Next, number 11. Which of the following would alert the nurse if stated by a patient prescribed to take misoprostol? A. I'm taking aspirin. B. My doctor asked me to eat protein. C. I can't clearly see due to this cataract. Or D. I missed my mini pill last night. So, misoprostol is used in ulcer because it's a gastric protectant. Okay. It is also used in OB because it's abortifacient, which means it can cause abortion. So when giving misoprostol and the client is a woman in childbearing age, you always ask if there's a possibility that the woman is pregnant. And between A, B, C, and D, the client most likely pregnant is Dallas. Because mini pill is oral contraceptive agent. So if you miss your pill, chances are you can get pregnant. This is the answer. Next, number 12. Zollinger-Ellison syndrome is one of the causes of the development of peptic ulcer disease. This disorder arises from ZES or Zollinger-Ellison syndrome it is a gastrin secreting cancer. Increase in gastrin, increase in hydrochloric acid. This cancer arises from Dallas. This is a cancer of your pancreas. Next, if a patient taking cimetidine comes to the clinic with complaints of disorientation, agitation, confusion, it is appropriate for the nurse to So cimetidine, this is an H2 blocker. It is used for ulcer, and this is the only the only H2 blocker that can cross the blood brain barrier. Therefore, if it can cross the blood brain barrier, it can be neurotoxic. And if your patient is experiencing neurotoxicity, silent symptoms are changes in LOC like disorientation, agitation, confusion. These are manifestations that cimetidine is already causing neurotoxicity. Therefore, the answer here is letter C. You notify the physician. Next, number 14. Bleeding from ulcer is not uncommon and may be life-threatening. Nurses should know that in order to prevent massive blood loss, vasoconstriction is stimulated with the use of which drug? A. Glycelyl, B. Atropine, C. Vasopressin, D. Norepinephrine. So first, let's eliminate A because this is for irrigation. Let's eliminate D because there's no drug as norepinephrine. Drug is epinephrine, not norepi. So that leaves us the only two options, B or C. Atropine sulfate has the ability to increase heart rate, but not a vasoconstrictor. While vasopressin is a GI. It's a GI vasoconstrictor. That's why it's being given if there is GI bleeding. The answer is letter C. Next, number 15. Which intervention is appropriate for a client with duodenal ulcer? A. Individualized comfort at night. B. Fluid and electrolyte replacement. C. Acid-base balance. Or D. Oral care. Well, tendency clients who need oral care are the one that induce vomiting. And we all know that gastric ulcer is the one that induce vomiting because gastric ulcer is relieved by vomiting. So eliminate D. Therefore, if they induce vomiting, they vomit uh, hydrochloric acid. They are prone to fluid and electrolyte imbalance. Okay, same. So eliminate letter B and D. That leaves us the only two options. Eliminate C. The answer is A because we all know that duodenal ulcer is nocturnal. This is nocturnal, which means it worsens at night. The answer is letter A. Next, number 16. Which is the best time to give sucralfate? Remember that sucralfate must be given on empty stomach. Therefore, the answer is Dallas. When the stomach is empty, that's the best time to give sucralfate. Next, number 17. Patient to the nurse, I'm concerned with my ulcer. My friend had this too and he underwent vagotomy. How come I will undergo another surgery? Which of the following is correct about pyloroplasty and will be the basis of your teaching? A. It involves repair of the ulcerated tissue. B. Removal of the ulcer. C. Enlargement procedure. D. Implantation of tissue graft. So remember, we're talking about an option that refers to pyloroplasty. Pyloroplasty is the enlargement. This is the enlargement of pylorus. Answer here, letter C. Next, number 18. A client arrives in the clinic with severe epigastric pain associated with nausea and vomiting. To rule out pancreatitis as a cause, expect the doctor to order. So if the patient have epigastric pain, the patient has either acute pancreatitis, or ulcer. And there are two types of ulcer, gastric and duodenal. So we all know that gastric or some, sorry, yeah, gastric is, this is what, relieved by, both of them can be relieved by antacids, while this is unrelieved by antacid. Therefore, expect the doctor to order letter A. If the client responded to letter A, patient has ulcer. The patient is or does not respond to A, possibility is acute pancreatitis. A is the answer. Next, a male client admitted due to bleeding peptic ulcer. The doctor ordered for urea breath test to be done in the morning shift. This order was intended to. So remember that urea breath test is used to um, diagnosing. This is used to diagnose H. pylori. This is your diagnostic test for H. pylori. Answer here is letter A. Next, when a patient tested positive for urea breath test, expect the physician to order H blocker N. So we all know that if you're positive to breath test, it means you have H. pylori. H. pylori is a microorganism, therefore the patient may need Boston antibiotic. The most common cause antibiotic is clarithromycin. Clarithromycin. Next, number 21. Which among the following is most likely experiencing ulcerative colitis? So, the given options refers to the location of pain, and the location of pain of ulcerative colitis is left lower quadrant. So, eliminate or right, right. So, that leaves us only two options, A or C. A, patient complaining of diarrhea with left lower quadrant, or C, patient with severe weight loss and left upper. Answer, letter A, left lower quadrant. Next, number 22. The first line of drug for IBD, inflammatory bowel disease, are where the first line of drug for inflammatory bowel disease. Which inflammatory bowel disease? This is your ulcerative colitis and your regional enteritis. The first line of drug are your 5-ASA. This is the name of the group. An example of this is sulfasalazine. Answer, letter A. Although we use these other options, the first line is sulfasalazine. These are 5-ASA. 5-ASA are what? Are GI anti-inflammatory. These are anti-inflammatory of the GI. Next, patient with inflammatory bowel disease is being treated with methylprednisolone. Which of the following symptom may indicate a developing complication? So, patient is taking methylprednisolone. This is a corticosteroid, and corticosteroid is an immunosuppressant. It's immunosuppressant. Therefore, the patient becomes prone to infection, or the patient's immunity decrease. And if you have decreased immune system, patient experience sore throat. Sore throat indicates a decreasing immune system. Therefore, the answer here is letter C. Next, number 24. Patient is taking sulfasalazine to induce remission of Crohn's disease. As a nurse assigned to her, she would educate that the client may develop A, B, C, or D. First, let's eliminate A. Although sulfasalazine can discolor the urine, it's not decolored. It should be red orange. Red orange. It does not produce abnormal foul smelling stool. However, sulfasalazine can decrease sperm count. It can decrease sperm count, which is reversible. Answer, letter C. Temporary infertility. Next. Regional enteritis is a chronic bowel disease that commonly affects which part? So, if we talk about RE, regional enteritis, common affected part is the terminal ileum. If we talk about ulcerative colitis, the common affected part is rectum, and it spreads towards your cecum, which means it may involve the total large intestine. It may involve the entire large intestine. In this case, it's regional enteritis. Therefore, the answer here is letter C. Next, number 26. This time, it's ulcerative colitis and the most common affected part. The answer here is rectum. Next, 27. IBD is disorder that may arise to systemic complication involving the eye, skin, and joint. Which joint complication is associated with IBD? IBD is your inflammatory bowel disease. The joint complication will be not osteoporosis. Letter B is due to cort- corticosteroid complication, not by inflammatory bowel disease. Answer, letter C. Patients with IBD also develop arthritis. Not only arthritis, they also develop conjunctivitis. Okay, C is the answer. Next, which pathologic changes would you expect to see on colonoscopy of patient with ulcerative colitis? When you say colonoscopy, direct visualization. Answer, Dallas. This is related to ulcerative colitis. Crypt abscess is also related to ulcerative colitis, but you cannot check this on colonoscopy. You can only check this if if it will undergo pathological exam. Cobblestone is regional enteritis, and perforation is both a complication of regional enteritis and ulcerative colitis. So if we talk about colonoscopy, it means direct visualization. We will see continuous ulcer for UC or cobblestone appearance for RE. The answer here is D. Next, during barium enema, patient manifested the classic String sign. This may lead to diagnosis of, isa lang ang sagot dyan, isa lang ang may string sign, that is Boston. Regional enteritis. How about if have the patient who has ulcerative colitis will undergo barium enema? What will the doctor see? Lead pipe appearance. Lead pipe appearance. If an RE undergoes barium enema, we will see the classic string sign. We don't do enema on CND. The answer here is Boston. Next, the result of an abdominal CT scan of a patient suspected to have inflammatory bowel disease has arrived and interpreted by the attending physician to be manifesting toxic megacolon. The patient is most likely having what? So this time it's CT scan and toxic megacolon. If the ulcerative colitis undergoes CT scan, you will see toxic megacolon. If RE will undergo CT scan, we will see fistula. And remember, the situation is referring to inflammatory bowel disease. C and D is not inflammatory bowel disease. Okay? So the answer is should only be between A or B. And the answer is letter A. Next, number 31. Which of the following would indicate a possible complication of regional enteritis? A. Abdominal pain, absent bowel sound, diarrhea, or intestinal bleeding. So when I say complication, it is something that is not expected. For example, if a patient have infection, fever is not a complication because it's expected that a patient with infection has fever. So three of these options are just a symptom. Only one is a complication. The answer here is Boston. Why? Because this is not expected in regional enteritis. If a patient who has regional enteritis develop or manifested absent bowel sound, it may indicate peritonitis. So this is a complication. Okay? B is the answer. Next. Number 32. Client, 43-year-old male with history of inflammatory bowel disease is on hydrocortisone medication. Which intervention implemented by the nurse indicates a knowledge about this medication? A. Is it nurse monitor vital signs at a regular interval? No, because regardless of what the patient is taking, you always monitor the VS at regular interval. Eliminate B because corticosteroid does not cause sedation. C. Staff nurse raises salary, or D. On-duty nurse includes annual checkup in the discharge plan. So remember that hydrocortisone is a corticosteroid, and corticosteroid can cause, in long term, cataract formation. Therefore, the answer here is Dallas. Next, number 33. Which nursing intervention by the staff nurse is inappropriate for a client with regional enteritis in active phase? So when you say active phase, it means patient is actively manifesting the sign and symptom of regional enteritis. So we're looking for something that is inappropriate. Answer, Boston. Why? Because it was indicated here in Boston that the client changes clothes. So remember that in your inflammatory bowel disease, which is RE and you see the main sign and symptom is diarrhea. Therefore, there is possibility of fluid and electrolyte imbalance. And therefore, because of this fluid and electrolyte imbalance, the best parameter to check for fluid status is weight. And when you weigh the patient, you should use same weighing scale and client use same clothes. Okay, therefore the answer here is B, inappropriate. You don't change the client's clothing. Same clothes. Okay, to be more accurate. Next, number 34. Which of the following would indicate that there is a need for dosage adjustment in a client taking prednisone after being diagnosed of Crohn's disease? So the issue here is the dosage of the drug prednisone. Which of the four, if manifested, needs or indicate there's a need to change the dosage? Answer, letter A. Why? Because remember that prednisone is the steroids. Side effect of steroids are hyperglycemia. And therefore, if patients having hyperglycemia, there's increased cell growth. Remember that steroids are also used by bodybuilders to increase their body. So if a patient taking prednisone manifested increasing in weight, there's a chance that there is too much steroids being administered. A is the answer. Next, number 35. Which ECG finding would alert the nurse that there is a developing complication of inflammatory bowel disease? So again, when we say inflammatory bowel disease, the main symptom is diarrhea. And if you have diarrhea, you lost potassium. When you lost potassium, you develop hypokalemia. And when you develop hypokalemia, the ECG is the presence of U wave. Answer, letter A. Okay, next. Patient arriving with severe abdominal pain located in the right lower quadrant, which data would contradict the diagnosis of appendicitis, nausea and vomiting, temperature of 39.9, rebound tenderness or passage of stool, absent of passage of stool. Answer, Boston, because client with appendicitis is manifested by low-grade fever. Low-grade fever. 39.9 is masyado mataas. Too high. B is the answer. Next, number 37. Which lab data correspond to diagnosis of diverticulitis? First, let's try to eliminate. So remember that this disease is in an inflammation because of the word itis. And if you have inflammatory disorder, your ESR should be elevated. So eliminate D. And eliminate A because there is no malabsorption. Low albumin count may indicate malabsorption. Here in this case, patient does not have malabsorption. So eliminate A. B or C. Remember that there's an inflammation or inflamed part of the intestine and the patient may bleed into the intestine. Therefore, the patient may be positive for guaiac test or your stool exam. B is the answer. Next, number 38. After the diagnosis of diverticulitis, a patient is to undergo surgery. As a nurse of the patient, you will expect the doctor to perform. So the what being asked here is what surgery is done for diverticulitis? The surgery for diverticulitis is called your Hartmann procedure. Hartmann procedure. This is your Hartmann procedure is described as primary resection and anastomosis. The answer here is letter A. Resection and anastomosis. That's your Hartmann procedure. Next, 39. During your routine assessment, a patient with suspected appendicitis awaiting surgery reports sudden change in pain level. Which would the nurse do next? Notify, auscultate, ask, or apply? Answer is letter C. You ask about the change in pain. After assessing or asking about the pain, that's the time you notify the physician because the change in pain, this is vague. It could mean anything, vague symptoms. So the nurse must clarify first what does the patient mean when he said or she said she or he is in there's a change in pain. C is the answer. Next, 40. Post appendectomy nurse in RR would position the patient in which of the following? So remember that the patient is still in the recovery room and all patients in the recovery room are positioned flat on bed, supine with head turned to the side. C is the answer. Next, number 41. Liver plays a great role in body metabolism. Nurses must be aware of the common factors that result to chronic liver dysfunction, like liver cirrhosis. Following are known to cause liver cirrhosis, except alcohol can cause liver cirrhosis, eliminate A. Virus can cause liver cirrhosis, eliminate B. Heart failure can cause liver cirrhosis because heart failure can lead to hepatomegaly. So eliminate D. Answer, letter C. Drugs effect on cirrhosis is, drugs effect on liver is hepatitis, not cirrhosis. C is the answer. Next, number 42. Pathologic exam of cirrhotic liver will indicate keloid, granuloma, fibrous, or fat deposit. Liver cirrhosis is a disorder wherein normal liver cells are replaced with normal liver cells are replaced with normal liver cells are replaced with fibrotic tissue. Fibrotic tissue. Therefore, pathology will affect fibrous formation. C is the answer. Fat deposits, nakikita yan sa fatty liver. Okay? Granuloma is tumutubo sa intestine, not on the liver. So eliminate D, eliminate B. C is the best answer. The only answer, okay? Next, number 43. Upon inspection of a client suspected to have liver cirrhosis, you notice some dilated veins surrounding the umbilical area of the patient. This lesion is referred to as. So when we talk about liver cirrhosis, some patient who has this disorder develop dilated veins or like varicose-like vein around the umbilicus. We call that your caput medusae. Okay? Dilated veins around the umbilicus, we call that your caput medusae. Caput medusae. D is the answer. Next, 44. Which fluid imbalance is commonly seen on patient with liver cirrhosis? Now, if we talk about fluid status or fluid balance in liver cirrhosis, remember that patient who has liver cirrhosis develops ascites. And when ascites is formed, this is similar to edema. However, ascites, the fluid is located in the peritoneal cavity. Edema is located between body tissues or between cells. That's edema. But regardless of when edema or ascites is formed, we call it third spacing. That's the term we use. Third spacing. The answer here is Boston. Next. 45. Patient with terminal stage of liver cirrhosis was diagnosed of encephalopathy. Nurse know that this complication is due to A. Inability to metabolize bilirubin. B. Loss of oncotic pressure. C. Unable to metabolize protein byproduct. Or D. Portal hypertension. First, let's eliminate A. Because if you cannot metabolize bilirubin, you will develop jaundice. Jaundice, not encephalopathy. If there's a loss of oncotic pressure, patient will develop ascites. Portal hypertension, this will also contribute to the formation of ascites. So eliminate B and D. Sagot, letter C. Unable to metabolize protein. Remember that protein in the body is metabolized into ammonia. Ammonia is toxic to the brain. Therefore, ammonia cannot increase in the body. So if every time you eat protein and ammonia is formed, it is converted immediately by the liver into BUN. Ammonia is converted by the liver immediately into BUN, and BUN is excreted to the urine. So if you have a non-functioning liver, ammonia increases in the body, it toxic your brain, the patient develop encephalopathy. Ence encephalopathy. Patient develop encephalopathy. This disorder is due to protein byproduct, which is ammonia. Next, number 46. Which of the following is the diagnostic test for ascites? Answer, letter C. This is your fluid fluid wave test. Fluid wave test. Next, number 47. Which of the following indicates increasing portal hypertension as a result of worsening liver cirrhosis? Portal hypertension is manifested by three. We have your caput medusae. What else? Spider angiomas, and of course, palmar erythema. A is the answer. Okay, next. Number 48. Which of the following food item would you recommend for a patient on early stage of liver cirrhosis? Sardine, instant noodle, egg white, or tuna? Answer, letter C. Because egg white is high in protein, and the patient in early stage of liver cirrhosis needs protein. Take note, early stage. During late stage, low protein, but we're talking about early stage. Next, 49. Patient was admitted due to bleeding esophageal viruses. Nurse will anticipate the insertion of. We all know that the esophageal viruses, we insert a tube called Sengstaken Blakemore tube. C is the answer. Next, number 50. Which of the following diuretic is best initial given to a patient with ascites? Answer, the best initial diuretic should be potassium sparing. The answer here is Boston. Potassium sparing. Because a patient who has liver cirrhosis has has a possibility of hypokalemia. So best given initially, potassium sparing. B is the answer. So that's the end of our rationale for your GI. I hope you got high. Thank you.